We have bad news for you in our Health Lead today. Glaring warning signs inside the United States as experts warn that the good vaccine news does not mean that we're in the clear. There are no states currently trending in the right direction when it comes to new cases of coronavirus. 44 states are seeing an increase in the past week. Yesterday alone, the United States added nearly 120,000 new cases and 472 people died from the virus. As CNN's Nick Watt reports for us now, doctors are worried about just how much worse this could get before it gets better.
I'm going to ask you a few questions. Okay.
While the virus runs rampant across the country, some very promising news out of the lab. Pfizer's vaccine might even start rolling out within weeks.
We have anticipated that we will have enough vaccine by the end of December to have vaccinated our most vulnerable citizens, enough for all Americans by the end of March to early April to have general vaccination programs.
And an antibody treatment from Eli Lilly just landed FDA emergency use authorization. Limited rollout begins this week.
Potentially in nursing homes, in outpatient centers, or even pop-up facilities.
This drug, similar to one used to treat the president, mimics the body's immune response, reducing the severity of symptoms in sufferers.
This will help reduce hospitalizations.
And in just a week, COVID hospitalizations nationwide have climbed nearly a quarter, now at record highs in 17 states. And in just 1 week, nationwide, the average daily case count has soared 42%, stands at nearly 120,000, never been higher. In South Dakota, more than half of tests are coming back positive, 10 times where states aim to be.
You don't have a mask mandate here, but what I would say to the people of South Dakota is you really shouldn't need a mandate to do the right thing.
In Nebraska, the governor and first lady are quarantining after dining outdoors with someone Sunday who tested positive Monday. Texas, about to become the first state to pass 1 million confirmed cases. In El Paso, 1 in 30 people has the virus right now. 6 morgue trucks already deployed. In the city, 4 more requested.
We've got some hard work to do before vaccines are going to make a difference over the next few months.
Now, this news from Pfizer is very, very good, do not get me wrong, but it is going to take a little time and there are some challenges. This vaccine requires 2 doses. It needs to be stored at extremely low temperatures, and also we still don't know how long any immunity it provides might last. Jake?
All right, Nick, thanks so much for that report. Joining us now to discuss, Dr. Anthony Fauci. He's the director of the National Institute of Allergy and Infectious Diseases and a member of the White House Coronavirus Task Force. Dr. Fauci, thanks so much for joining us. We just heard about how new cases are climbing. How much worse do you expect this to get before it gets better?
Well, unless we really double down and do the public health measures that we've been talking about for so long, Jake, if you look at the numbers and the number of cases that we're seeing each day, over 100,000, and the deaths ranging, from 800 to over 1,000, you can do the math yourself. It could get much worse. And that's the reason why we really are pleading with the American public to really take seriously. We're not talking about shutting down. There's always that misunderstanding when we talk about public health measures. We're not talking about shutting down. We're talking about the 4 or 5 things I talk about all the time: wearing masks universally, keeping a distance, avoiding congregate settings, crowds, particularly indoors, doing things much more outdoor than indoor, and washing hands. The news about the vaccines is extraordinary, Jake. It is really a major
let's talk about that.
And ultimate public health. But the point I want to make is that the news of the vaccine should not get people to say that we don't need to continue to do the public health measures, because I look at the vaccine is that help is coming, and it's coming soon. We likely will be able to start dispensing vaccines in December and then progressively over the next few months. But in that interim, we could get into a lot of difficulty if we don't adhere to the public health measures.
Right.
When we get both of those 2 things together, a vaccine and public health measures, that would really be a game changer. But for the time being, we've got to adhere to the public health measures. And I hope that the fact that people realize that help is on the way in the form of a vaccine, and soon, that would get them to be even more motivated to do the public health measures. Because when you know help is on the way, don't give up. There's a real thing called COVID-19 fatigue that's understandable. We understand how difficult that is. But hang in there a bit longer.
Right.
Do the thing you need to do, and we'll be okay.
So let's talk about this vaccine. Pfizer's vaccine appears to be more than 90% effective. Now, you say the first doses could go out at the end of this month or December. Who will get those? When will the rest of us, the majority of Americans, be able to go get a vaccine at CVS or at our doctor's office or whatever?
Well, Jake, so that the viewers understand, there's a tried and true process. Ultimately, the Centers for Disease Control and Prevention are responsible for the prioritization. They do that with help from an advisory committee on immunization practices, the ACIP. That happens all the time when there are vaccines either in short supply or vaccines such where you can't vaccinate everybody all at once and you need to do a prioritization. That's being supplemented by the National Academy of Medicine weighing in on that. It is likely, though the final determination has not been made, that healthcare providers who put themselves in harm's way to take care of individuals will be of the highest priority. Then obviously you'll have people who have underlying comorbidities that put them at a high risk for serious outcomes, elderly individuals in that category. Then you have elderly individuals in general and people who are part of the important infrastructure in society. And then you have people who take, for example, in nursing homes and in other congregate settings that need protection. And then school teachers and school children. And then as you go down the line, you get the people who are essentially normal, have no comorbidities, and are not elderly. Those will be phased in over the next few months.
Okay, Pfizer says that they do expect some logistical challenges in distributing the vaccine because, well, first of all, this is the United States of America. It's a lot of people, 330 million, big country. But also 2 doses are required. It needs to be stored in freezing temperatures. How much of a barrier do those details, the 2 doses and the freezing temperatures, make it to get the vaccine widely distributed?
Well, a couple of points about that, Jake. A, I don't think it's a barrier. It's certainly a challenge, I think would be a better way to describe it. But it's not a challenge that's unanticipated. That was part of the Operation Warp Speed agenda, namely the scientific agenda led by Moncef Slaoui and the logistic or supply chain agenda led by General Gus Perna. And that's what he's been spending literally every minute of every day on making sure that doesn't become an obstacle, it becomes a surmountable challenge. And I think that's what's going to happen. I mean, obviously, to say it's going to be easy would not be truthful. It's going to be a challenge, but I believe we're going to be able to do it.
And then just to drill down on the idea of when most people, the lowest ones on the priority list, like me, for example, I'm not high on the priority list. When will I be able to get the vaccine? When would my family be able to get the vaccine? Do you think by May, by June? What are we talking?
No, we're talking probably by April, the end of April, I would think. Again, these are just guesstimates.
Right.
I believe that within the first quarter. One of the things that we were concerned about, Jake, and I discussed this with you on a prior interview, was that we have a lot of people in this country who may not want to get vaccinated right away. That's why we were talking that it might take well into the second and third quarter to finally get people to be convinced to get vaccinated. But for those who want to be vaccinated, and I believe the incentive to get vaccinated will be greatly enhanced by the degree of efficacy. When you hear something is 90 to 95% effective, it makes it much more likely that someone would want to get vaccinated. But if Jake Tapper wants to get vaccinated, I think you're going to get vaccinated within the first 4 months. I would say by April, you'll be able to be vaccinated.
All right, great. Good news. Dr. Anthony Fauci, thank you so much. Talking about one of the great achievements of the Trump administration, Operation Warp Speed, for which they should get some real credit, as well as obviously Moncef Slaoui and the whole team. Thank you so much, Dr. Fauci. Appreciate it.